it's going.
All right. Since we didn't really get a chance to work with each other, we just kind of had feedback from Dr. Smith herself individually. So what we're going to do is just kind of share upon that. And so the first thing I'm going to ask Brad is, what did you do? What did she say you did well?
So Dr. Smith said that the progressions I chose for my patient were appropriate and tested her quite well. Like when I moved her to the AirX for her single leg stance, because she was doing her step downs without really any issue. So that was mainly what she focused on for my positive feedback.
And then what were the two things that she said that you could work on and improve on?
So she said I have to be careful whenever I'm educating the patient, especially on like surgical procedures, because that's not necessarily our scope of practice. So we don't want to be stepping on any toes or doing anything like that. So educating about outcomes might be more appropriate, but that's just that's a gray area that we gotta be careful with. And then also when I'm doing documentation, I just gotta make sure that when I'm doing the assessment, especially for daily notes, I need to put in there when I am progressing an exercise, why I am progressing it, for like their functional goals, and also why I decided that that exercise should be progressed. So those were just some areas that were lacking in my documentation before Dr. Smith checked on it.
Okay.
So for you, what was a source of positive feedback that Dr. Smith gave you?
She said I definitely did well interacting with the patient. So just kind of greeting them and just being interactive with them throughout the entire session. Being able to kind of keep up with like patient like interaction talking while still doing the exercises and progressing things smoothly. Yeah, that's about it for that one.
Okay, and then two sources of constructive feedback.
So similar to yours, she also told me that I need to work on my documentation, being able to kind of like link the knowledge that I have and then kind of write it down and apply it to how they have like to meet their functional goals, and just kind of how to apply in terms of the anatomy, to the treatment, and down to the goals.
Gotcha.
And then the next one would definitely be the order of carrying out the treatment, because I first started with doing more strengthening exercises, and since my patients had an instability issue along with adhesive cap, she told me that it was better to do the stabilization exercises to help to mitigate or lower the instability, and then after we could work on the strengthening aspect of it.
Gotcha. Okay, sounds good.
All right.